Let's look at the information contained in the reports so you can understand it and how it might guide therapy. The patient's demographics are located at the top of the report. Right underneath this, there's a statement that mainly summarizes the rest of the information on the report. The protein biomarker graph displays the roles in the formation and progression of cardiac lesions. The graph identifies the factors that are contributing most to the pulse cardiac score. Each column shows how each marker is impacting endothelial health. Red indicates damage and increased risk of ACS. Green indicates protective and decreased risk of ACS. The pulse score quantifies endothelial damage and predicts the likelihood of acute coronary syndrome within 5 years. This is an absolute risk score for an individual. We categorize the disease stage as normal, borderline, or elevated. A score that is borderline reflects the natural increase in ACS risk as we age. In this example, it means that approximately 39% of the people who matched this patient's age, sex, and score had a heart attack in the next 5 years. However, 97% of the population didn't. Hence, the expected score of 2.68% if everything was perfect. The pulse expected score gap represents the relative risk of much more likely a heart attack will happen to a patient. This number is attained by dividing the pulse score by the expected score. In this example, the patient's pulse score is 14 times the expected score of 2.68 based on the patient's age and sex. The last section of the first page provides the patient's class based on the American Heart Association and the American College of Cardiology cardiovascular risk guidelines. In this case, the patient would be considered high risk. The second page includes the protein results section. The table shows the biomarkers involved in the test and the relative percentage contribution, divided into normal, borderline, and elevated to the pulse score. This is useful in cases where a patient may have normal lipid values but a high pulse score. Looking at percent relative contribution can help formulate treatment options. Heart age is another way to understand the progression of the disease. Where relative risk looks at the likelihood of a heart attack compared to the control group of similar age and gender, heart age provides a simple way to grasp where the heart is chronologically compared to one's actual age, using the same score values. In this example, the patient age is 59. However, their calculated heart age is 80, a difference of more than 21 years. Note that heart age maximum will not exceed 80. Underneath the heart age section, this score serial results graph will track a patient's progress and trends as treatment and lifestyle changes progress. This provides an additional reference for physicians and patients alike. Ideally, the patient will have a downward trend. On first-time test results, this graph will be blank. Now we also offer an expanded lipid profile, which is evidence-based. We do direct measurements on everything except for the ratios. There's a table which includes some risk factors, like smoking status, family history, blood pressure, and cholesterol. This is a 52-year-old physician. His BMI is 26 and has a positive family history. There's been an abnormal hemoglobin A1C or blood sugar for about 10 years. LDL cholesterol, the primary determinant of what doctors do today, is normal. However, the pulse cardiac test is 8.75%, which is high. It's almost 5 times what is expected for this patient's age. We did a diet and lifestyle audit and found he hadn't been exercising and that he ate 3 to 4 candy bars a day. When observing the results, LDL only goes to borderline or unfavorable if too much sugar, alcohol, and refined white carbs like white bread or white rice are consumed. We could have put him on a statin or some other medication, but he wanted to do lifestyle, so we gave him 4 months. This was the prescription. We had him walk briskly 30 minutes, 3 times a week. On alternating days, instead of sitting down and watching TV, we had him do resistance training with a 12-pound kettlebell and dumbbells. The only diet change we made was cutting out sugar and refined white carbs. The patient was allowed to eat complex carbs like oatmeal, bulgur wheat, and whole grains. In 4 months, he lowered his pulse cardiac test score from 8.75%, which is high, to a 2.24%, which is normal. His heart age went from over 80 down to 55. He lost 16 pounds while increasing his muscle mass. Best of all, his hemoglobin A1C showed normal for the first time in 10 years. The next example comes from a CEO who dealt with a lot of stress daily. For her, the only abnormalities were positive family history and a borderline BMI. Risk calculators, lipids, and PULS test scores were all normal. However, she was not happy to see her heart age was 11 years older than her chronologic age. She wanted to get it down. A lifestyle audit revealed that she was running 8 to 10 miles a day, and to do that, she was carb loading with sweets like candy, pizza, white bread, pasta, and wine. Her routine did not include resistance training. We asked her to cut back running to 3 to 4 miles a day and switch 50% of her exercise routine to resistance training, weightlifting. As far as her diet, we asked her to limit alcohol intake to 2 5-ounce glasses of wine a day and get rid of bad carbs while focusing only on complex carbs. In 2 months, she shaved 8 years off of her heart age, and her pulse score moved down from 2.77 to 1.78. The pulse score predicts the likelihood of acute coronary syndrome within 5 years. We categorize the disease stage as normal, borderline, or elevated based on the score. The expected score is the ideal cardiac score based on the patient's age and gender. The protein results section shows the biomarkers involved in the test and the relative percentage contribution. This is useful in cases where a patient may have normal lipid values but a high pulse score. Looking at percent relative contribution can help formulate treatment options. Heart age provides a simple way to grasp where the heart is chronologically. Note that heart age maximum will not exceed 80. Congratulations, you've completed the third module. Continue to module number 4 when ready.